Good morning. It is still morning, even if you're on mountain time, a little bit. Welcome to our presentation today. I am very excited to be sharing with you. Today's presentation is Demystifying Prescription Drug Benefits. I am your host, Arwen, with my dear friend and colleague, Miss Kelsey Moen. We're very excited to take you through this presentation this morning. As you have questions during the presentation, please utilize the chat function. We will have a Q&A period at the end of the call where we'll address any questions that were not answered during the course of the presentation. Just as a note, this presentation is being recorded. If you do not wish to in a recorded call, please disconnect yourself. And this presentation, just as a reminder, is a courtesy service to our clients and friends and is designed to give general information and is not legal advice. We are not lawyers, we're not attorneys, and we are not professionals. So with that, I'm going to go ahead and turn it over, next slide, to talk about Miss Kelsey. I'm going to kick us off with what we need to know about demystifying our prescription drug benefits.
Absolutely, Arwen. Thank you for having me. Hello, everyone, and good morning. Today, we are going to unpack exactly what you need to know about prescription drugs. So we're excited to just break down some basics today, talk through what tiers mean, formularies, what's generic versus preferred, and hoping that you walk away feeling more educated when you are looking at your employee benefits offerings.
Oh, there's our disclaimer. We're not lawyers. We're going to say it again. Oh, look, there's us. Miss Kelsey, I'm not so good at this clicking part, apparently. Here's our face. Right, let's go ahead and jump right in. I feel like I was probably supposed to click through our slides as I was giving my disclaimer, but I'll remember that for next time.
You're just on autopilot, Arwen. You don't even
I know.
down.
All right. So, Miss Kelsey, what aspects of prescriptions and understanding our prescription benefits are we gonna talk about and should we know walking away from this conversation?
Absolutely. Well, when we started looking at what we should know are our takeaways, we could have had this webinar be much longer than just the 30-minute time allotment that we had. But we really wanted to pick what are those top items that if you know you can walk away with and have a more educated conversation about maybe which prescriptions you're on, what opportunities are out there for you, or when you're looking through your benefits and on your summary benefits coverage, it says that a prescription's maybe in my first tier or my sixth tier. What does that actually mean? So our goal here today is really just to walk away being educated on what the prescription world really looks like. Okay, so first up on our agenda, we have medication tiers. Now, most commonly, insurance companies are either going to have a 4-tier or a 6-tier. Now, there are some other arrangements out there, but again, most commonly 4 or 6. So here is an example of a 6-tier. Now, when you're looking at your summary of benefits coverage, or maybe it's open enrollment, you have a beautiful benefit book that you're either clicking through online or looking through. When you get down to your medical plan and you see your prescriptions, you're going to see these different names. And what do these mean? We have preferred generic, non-preferred generic, preferred brand name, non-preferred brand name, preferred specialty, and non-preferred specialty. So I like things that have little memory hooks. They tend to stick in my brain. And so when I was thinking about what's the best way to remember kind of cost-wise or level-wise where all these different tiers fall, or when you can giggle a little bit here, but here's my memory hook. When I think of a preferred generic, this is your super laid back, easy friend. They're going to take 5 to 10 minutes to get ready. And when you guys go out to do anything, you don't have to spend any more money. It's just generic, it's chill. It's going to cost you generally around $5 or $10 to have a copay, which we'll get into in a little while too. Non-preferred, maybe these friends are taking a little longer. Maybe it's 10, 20, 30 minutes that they need to take to get ready before you can head out and hit the town. And maybe they want a milkshake with their fries. So they're not really high or high, oh gosh, my words are gone.
High maintenance? Is that
Thank
what
you.
Yeah,
Yes,
high maintenance friend.
Yeah, they're not super high maintenance, but they're going to be a little bit more than our preferred generics. Now, when we get into that preferred brand name and non-preferred brand name, those ones are going to take a little bit longer. They're going to be that 50 to 60. Maybe they're the ones that say, hey, 5 more minutes, I'll be ready. And you're sitting there waiting for an hour and a half or so for that friend to get ready before you guys can hit the town. Now, your specialty, those are your very high maintenance. Generally, they are going to have the commercial about them. They want to be in the spotlight. They're going to have a little sing and dance, and they are going to be your top tier or your most expensive, highest maintenance when you're thinking of those friend categories. So let's break down a little bit more in talking about what would make something preferred or non-preferred. So difference between preferred, non-preferred. Preferred medications, they're selected by insurance companies as the preferred option. So when you think about who's making your VIP list versus who maybe you just have to invite, but don't necessarily want on that top have to be their list. So they're often chosen based on factors like effectiveness, safety, cost effectiveness as well. And these are those ones that are going to be a lower cost because they have been preferred in your insurance's formulary. They have a typically lower out-of-pocket cost for the patient, such as a lower copay or coinsurance, which again, we'll break those down just a little bit as we get into this as well. So that's the preferred. They're on my VIP list. I want to have them low cost, low maintenance, and we love having them at the party. Next up, we have our non-preferred medications. So these ones are going to be identified by the insurance companies as least preferred medications to fill or cover. Now, these could fall in a generic category. They could fall in a brand category, but again, they're ones that aren't quite on that VIP list. Maybe they have a higher cost out of pocket for the patient and as well as the plan, right? Because there's costs that not only happen as you when you're going to pick up those prescriptions, but also on the backside for your employers and for your plan sponsors. They might be more expensive, or maybe they have a generic or a preferred generic that they want you to try before you come into this non-preferred medication. Might be some other options out there that work just as great, but might not be as costly to your pocketbook.
Yeah, Kelsey, I think one example that you hit on that I really like is that I think, in maybe 10 years ago, generic meant the least expensive, right? And especially because the generics came about as patents expired for the fancy brand name medications, and generics weren't allowed to enter the market until those patents expired. But I think what we've seen over the last 10 years that you kind of touched on is that generic no longer means inexpensive, right? I just pulled up on GoodRx, for example, the most popular expensive generic drugs. And there's one on here, Tadalafil. It's over $500 a month, and it's a generic. And so I think that that's a great example of the fact that these, the insurance companies are responding to expensive generics hitting the market and creating that differentiator between your truly laid back friends and your friends who say they're laid back, but they're not.
Absolutely. And that was a great call out. Thank you. Okay, so now we have the formulary, or as I would like to call, it's that formal invite list, right? Have you ever gone to maybe, college days, you went to that club or that very exclusive party, or maybe even a wedding that was by invitation only, and you have that little bit of anxiety when you're going up and maybe there's the ropes and the big bouncer guy and he says, "What's your name?" And you say, "Oh gosh, I hope I'm on the list." And you give him the name. And hey, if you're on the formulary, which is your plan's formal list of approved prescriptions, yep, you get to walk right on by. But if your name's not on the list for your pharmacy coverage or formulary, then hey, it's not a no forever. It's just a no, not right now. So breaking down this formulary list a little bit. It's a list of tiers that are covered under your prescription drug coverage in your medical plan. One thing good to know is this list is continuously changing. Generally, when it comes to the formulary, changes occur at the start of each year, but sometimes throughout, insurance companies may update their formulary as quick as quarterly. So we do see a lot of employees that call into the office and say, "Hey, Kelsey, I've been on this prescription for almost a year now. It has only cost me my $25 copay, but it's January 1st. I went to fill and now it's telling me it's a $200 copay. What's the difference?" Really, what that means is behind the scenes, there's been a change to your formulary. Now, one thing that's really good to know is this isn't a Russian roulette board that's happening behind the scenes, and your insurance carriers are just saying, "Hey, what can we add or what can we take away right now?" Right? You actually have a committee of doctors and pharmacists that work at these insurance companies that are being very intentional about which drugs are put onto your formulary versus which ones aren't, or which tier they fall into. So we have a screenshot here of a few of the drugs. This is from Regence Blue Shield's 6-tier formulary list. And on the right-hand side, you can see which tier they fall into. So that tier 1, those good old amoxicillins, penicillins, those antibiotics that generally are going to be very low cost, they're preferred generic, they're going to be in that tier 1. Now, as we go down, we can see that a different mix of amoxicillin and clavonate. Arlen, is that how you would pronounce that one as well? Oof, man.
Who knows?
The mix between those two are actually going to fall into your tier 2. So perhaps that is your non-preferred generic. So although it still has a generic, it's not on that preferred VIP list, and it may cost your next higher up copay. Now, when we get to levels 4, 5, or 6, when you're thinking of 5 or 6, generally those ones, as I mentioned earlier, they are going to have a commercial, right? They're the high maintenance. They're the Ozempic, or oh gosh, there's an antidepressant one that always plays in my head too. And oh man, I was thinking
Lots of smiling people, lots of hugging, lots of flower shopping at farmers markets.
yeah. And I guess a fun fact there is the United States and New Zealand are the only 2 countries in the entire world that even allow that consumer or direct to consumer advertising. So we are one of the only 2 countries in the world that allow for prescriptions to even come over on a commercial, which I thought was interesting. In other countries, they rely on the doctors to tell you as a patient what would be your best one. But when we flip on the commercials, we see those fancy tunes and those very happy, smiley people with those flowers. We're going to our doctors and we're saying, "Hey, this is the one that I want." Those are going to be your specialty drugs. Now, with that, we'll talk a little bit about kind of step therapy in a few moments here too. But just be thoughtful that there may be a lower cost option that is available to you. If you want to see those, this formulary list is an awesome way to do that. These are not secret sauce. If you want to know what tiers are, you can look at your full formulary list. Generally, they're posted on your insurance carrier's website, or if you are a client of ours, you can give our office a call, and one of our benefit coordinators here can get that list to you.
Yeah, and Kelsey, just because you're talking about the commercials, I did some quick Googling because I was curious, right? We're one of 2 countries that that allows advertising. Pharma, this is according to Statistica, and it's got a couple different sources that it's relying on because I don't like spouting out information without citing my sources. The pharmaceutical industry is spending an estimated $1.2 billion per month on consumer advertising. So that's going to be commercials, mailers, ads. It's pretty crazy. And then I also
billion
with the B.
Oh my goodness.
Yep. And then I also wanted to speak to the fact that if this formulary is important to pay attention to, if you're an employer and if you're an employee, there's 2 sides of that, because if you ever experience a change in insurance companies, right? As an employer, you say, "You know what, we're going to switch from insurance company A to insurance company B." And this formulary is where the most disruption can potentially occur, because what's a tier 2 with insurance company A might be a tier 3 with insurance company B. So that's something to keep in mind when changing insurance companies. And then from the employee perspective, if your HR tells you, "Hey, we're changing insurance companies and you need to check your prescriptions," this is what they're talking about, is check and see, because it may be lateral, it may not. So I just wanted to call that out too.
No, that's a great call. I think another example of a formulary change is when a new medication comes out, when it's brand new, it's not going to be on that formulary list until the insurance companies, those pharmacists and doctors have been able to meet, decide, is this a safe and effective? Is this one that we want to be able to have approved on our formulary list? So what we've seen happen too, and I guess a real recent example is I'm sure that you have all heard by now of GLP-1s. This conversation is just everywhere right now. What these are your Mounjaros, your Ozempics, your Trulicities. These kind of medications, we'll use Mounjaro, for example. Mounjaro came into the market a couple years ago now, and they wanted to get this medication distributed. And it's a wonderful medication for those with diabetes. What they quickly discovered is that there is a tremendous amount of weight loss opportunity that occurs when someone's taking this medication too. So if you are involved in the TikTok world at all, this just spread like wildfire. And every celebrity, everyone has to get on that Mounjaro because they want to see those awesome weight loss. Well, when the prescription manufacturer comes out, they want to make it accessible. Now, just to give you guys an idea, this prescription is anywhere from $1,000 to $1,300 a month. Okay, but these manufacturers come out and they say, we've got a coupon card. You can have this medication now, $25 a month with their coupon. Now that worked really well until it started hitting formularies. So we had an example of an employee call in and they'd been able to take this $25 copay card from the manufacturer, utilize it. This prescription was working great for them. And then July happened and they went to go fill that and they got that bill of $1,000 at the pharmacy. So they called into our office, obviously upset about $25 to $1,000. That's quite a different hit to your pocketbook. And so when we did some research and diving down, we realized that Regents had updated their formulary in July based off of what was happening in the market and when it finally hit and there was enough studies. So again, be prepared that formulary levels can change. You can go for something that's either maybe a 1 or 2 into a higher one when switching to a different carrier, as Arwen mentioned, or just when those new drugs are hitting the market and they haven't even hit the formulary yet. Okay, so we've talked a little bit about copays previously. So let's really talk about the difference between deductibles versus copays. Now, if you are on a traditional PPO plan, chances are you have a copay. A copay is, think of it as your movie ticket, right? You buy a ticket, that's your access to go see the movie. With your copay, you're paying that fee and that's your access to that medication. Now, some PPO plans, those traditional plans, do have a prescription deductible. So on top of your medical deductible, maybe you're on a traditional 1,000 plan, which would mean for the calendar year or your plan year in some circumstances, you would need to pay the first $1,000 before your insurance company is going to come alongside you and start sharing the cost of services for you. Now, some plans do have an additional prescription deductible. A lot of times you'll see like a 250, 500, or sometimes the full deductible will apply. So be cautious of that when you're looking through your benefit summary, especially if maybe you have a multiple plan offering. If one plan looks very attractive versus another plan, if you do have prescriptions that you're taking on a monthly basis, take note to the bottom portion where prescriptions are to see if there's an additional deductible. What that would look like is if you were having a generic. Let me back up. Generally, generics are excluded. Preferred generics are generally excluded from that deductible list. But say you have a brand name medication that you want to go access, and on your benefit summary, it says that you should have a $30 copay for this brand name, preferred brand name, but you haven't met that deductible. When you go to get that prescription filled, you would still pay the full cost of the medication up to that $250 before you get to start accessing that with just that $25 copay. Now, on the flip side, a high deductible health plan, HD, HP, HSA qualified, however you want to call it, when you have that high deductible health plan, it does not run on a copay basis because there's no first dollar benefits with those type of plans. So be prepared when you have a prescription and you go to fill it, you are subject to your full medical deductible before you're going to start seeing some cost share with your insurance plan. Now, that's not to say that penicillin is going to cost you $1,000 because your medical deductible is $1,000 or $1,600, $2,500. If that drug really is a generic, you're going to go off of the pharmacy cost of that. So it still should only cost $5, $10, whatever the generic cost is. But just know you are paying 100% of your prescriptions before you reach that deductible.
Yeah, and Kelsey, I think when we go out to do these employee open enrollment meetings, we talk about the benefits, and especially if somebody has access to both a traditional and a high deductible health plan, I almost feel like the medications is one of the main driving factors that we talk
Yes.
to people about whether or not one plan is better for them than the other. I know for me personally, just kind of sharing that I know I'm on, a preventive medication, which we'll talk about a little bit later. And then my medication, like you said, I have to pay the full cost of it. It's subject to my deductible, but it's $4 whole. Like, oh no, and so for me, like my medication needs align well with the high deductible health plan. But I know that there's individuals out there that are managing chronic conditions that are going in for quarterly injectables. Maybe they're managing Crohn's and, something like that, where if it's a preferred brand name and you're going to pay a $50 copay, whereas maybe if you're on the high deductible health plan, that same medication would be 13, 15, $3,000. Like, I think just thinking through the two plans, like prescriptions are a huge piece that we talk to people about when they're choosing one or the other.
I would absolutely agree that a lot of times that is the driving factor of which plan makes more sense for an employee to choose between that traditional or that high deductible health plan. Prior authorizations. Okay, so the 2 and 3 on here is the tier, and then you're going to see some jumbled letters behind. What do these mean? So prior authorization. Now I've already talked about the GLP-1s, the Mounjaro, so I'll just use that as an example here as well. And Ozempic is one of those in the screenshot, so perfect. Prior authorizations, this is really a safety measure that is put in place not only for you as the employee or the patient, but also for plans. Now, with this one too, Mounjaro, Ozempic, they came out really as a diabetes medication. Now they're using off-label for weight loss, and both of those medications have now come off with a absolute specific. You have Zepbound, which is the Mounjaro for weight loss. You have Wegovy, which is the actual weight loss medication for Ozempic. But what these PA, so as Arwen has circled on this slide here, that's a prior authorization. Now, if you go to your doctor and say, hey, I want to get on Ozempic or Mounjaro, would that be a good fit for me? And they write you a prescription because they say, yep, it would be great for weight loss, or now cardiovascular disease is a new fun side effect of those treatments. Or treating, not side effect, it treats those. Okay, back up here. But you go to your doctor, you have that conversation and say, hey, I've seen this weight loss, I want to try this. And the doctor writes you a prescription, they submit it to your pharmacy, you may get a denial. And the reason why you're going to get a denial is because this little PA on the formulary is stating, hey, we need a prior authorization. So the insurance company is going to go back and ask the doctor, or ask you, do you have a diabetes diagnosis? Do you have an actual diagnosis to be able to prescribe a certain medication? And if you don't, chances are it would be denied and you need to look at a different one, or be prepared to pay for that medication at full price. Now, just because something is not on your formulary does not mean you can't have it, right? It just means that your insurance company is not going to help pay for the cost of that medication. What do we have next? Quantity limits. So again, with the PA, now we have this 1 pen or 28 days. Now, quantity limits are put in place not only again for the employee, but for the plan as well. Now, think about if you had a 90-day prescription and you went and you filled it, you've got a 90-day supply, but 30 days into that new medication, it's not working, right? Maybe your side effects or it's not having the right desired outcome, and your doctor decides, gosh, we need to change your prescription. What do you do with that 60 other days of prescription that you've already paid for and that you're not going to be utilizing? There's no refund policy at Walgreens, right? So these quantity limits are put in place sometimes. Sometimes there isn't one. You can do a 1 month or a 3 month, but on certain medications, if you do see the QL, which is quality limit, it'll tell you how many you can buy per prescription.
And I think to your point, Kelsey, right? These prior authorizations and quantity limits, I like to think about how like at a company, you joke like if there's a rule, it means like somebody did something to make the rule, right? Especially if a rule seems goofy. And
Yeah.
so I think that, sometimes we'll field calls from people that are frustrated by the prior authorizations and the
Mhm.
quantity limits because maybe like in this example, maybe they are truly the diabetic, who would really benefit from this and the paperwork is very tedious to go through. And I think what is important to realize is that these were in place because somewhere along the line there was abuse
Yeah.
where prescriptions were being filled for conditions that they weren't supposed to be prescribed for. Or I know I read a lot about the opioid epidemic.
Mhm.
The lack of quantity limits really strongly contributed to the opioid epidemic. And so a lot of these rules came out of a history of abuse. And when someone's frustrated from this red tape that they have to go through, like we're very empathetic and we try to explain like this is the why behind it. It's not to make your life harder, it's to protect the parties involved. But we definitely understand that it can be frustrating for sure.
Absolutely. Step therapy. Okay, so this one we talked about a little bit previously, but if you have a specialty drug or there's a drug that you would like to try or that your doctor has prescribed, there may be a generic that's available that has the same efficacy, sometimes even a higher efficacy than a specialty drug. So we have a little example here. We have Joe Smith. He wants to take medication B, and medication B is going to be Lipitor. So Lipitor is a brand name cholesterol medication. On average, it costs about $438 to fill a month's supply of Lipitor. The insurance company is going to say, hold on, Mr. Joe, have you tried the generic for Lipitor yet? So I butcher the pronunciation of this one, but it's going to be,
Torvastatin.
thank you, atorvastatin.
I take that one. That's why I know it.
Oh, yeah,
Torvastatin.
I'm not gonna lie, I had to have Google pronounce it for me and I still get tripped up on it.
Torvastatin.
So thank you for hopping in there. So the insurance company is going to come back and say, hey, Joe, we need you to try this generic option first. In reference to the 438 Lipitor, this generic, it costs on average $9, right? So we want to make sure that Joe can try this $9 medication. But we realize Joe's actually allergic to a coating on the generic. So inside, the medication's totally the same. The outside, just the coating, Joe has an allergy to. So he's done his step therapy. He's tried or at least evaluated the generic with his doctor and said, no, this isn't an option for us. So now they are going to allow Joe to go to that brand name, be able to fill that Lipitor, and the insurance company will cover that for him and he'll just pay his appropriate copay. So now, next up, and I think this might be our last topic on our agenda today, we have preventative RX. So Arwen shared a little bit too here, but there are certain medications that your insurance company will cover 100%. Just like our preventative care, like our annual physicals, ladies exams, mammograms, colonoscopies, all the fun things. Some of these that are under the preventative category will be covered in full. Now, it doesn't matter if you're on a traditional PPO plan or a high deductible health plan where you don't have any of that prescription first dollar coverage. If it is classified as a preventative drug on the formulary, then you are going to be able to access that drug at no cost out of your own pocket. And there's that drug again, right there. So okay, Arwen, say it for me again.
Atorvastatin.
Torvastatin is this generic, is also considered a preventative. So Joe, if he wasn't allergic to that darn coating, he would be able to have this prescription at no cost, which would be just as efficient in treating his high cholesterol as that brand name Lipitor would have been.
And I know for me, I really appreciate this list because, right, we have all this red tape for certain medications, but then on the flip side of it, there are medications that the insurance company is like, no, please take these, please stay well because they help prevent bigger things that would be treated by even more expensive medications. So there's birth controls, there's cholesterol medications. I know there's certain types of insulins. Like I think metformin, I think is one of the for like oral insulins that are on the list. There's cholesterol medications, and there's a litany of medications, and I appreciate that they make it so available. Like, we don't care what plan you're on, please just take your preventive medications.
Absolutely. And as we have highlighted on the slide too, it very clearly states it on your formulary. So even if you just have curiosity and you want to see which kind of medications require a PA or have quality limits, or that are those preventative, then you can go to your carrier website, you can call us, we will get you in contact with that formulary, and you can see which prescriptions fall into which categories.
And you are right, Miss Kelsey. That was the last, and we arrived at the doorstep of 10:30. We couldn't have planned it better. I didn't see any questions in the chat or anything like that, and so I'm just going to assume that you just are that good at explaining how prescriptions work. Of course, if you do have any questions after the fact, like Kelsey mentioned many times during this presentation, you are always welcome to reach out to our team. We are here to assist you. If you're an employer and you're in HR, this is something that, and if you go, hey, I want, to get my hands on the list of preventive medications so I can share that with my employees, like that's something we can get to you for sure. And if you're an employee and you're wanting to know, hey, I take this medication, is there a better alternative for me? That's something that we can help with as well, because we are here to assist. So, Kelsey, thank you so much for your time today, and for sharing all that great information. I super appreciate you. And again, I'm Arwen. This is Kelsey with Advanced Benefits, and thanks for your time today. We appreciate it.
Thank you.
Have a good one.